daily basis we diagnose a child with autism. It's like a freshly diagnosed case. Children born around August of September 2019, they were around 6 months of age when the lockdown started. That is the age when the child would interact, smile, look around, try to roll, probably attend functions, would get a lot of exposure to the social setting. That did not happen. But interestingly, every child during that time did not develop autism. Vaccine has no relation to autism. This is a big myth that is being propagated for many decades now.
The summary consensus that not in India but across the world is that this rise in cases is more explained by more awareness and better identification.
By 18 months, a child should be able to wave bye-bye, show emotions or understand emotions in the other person. Many of our family members speak slowly, so your child is also speaking slowly. This is a common myth which is propagated, and many times parents do not seek timely help.
Okay, if a child does not speak, or address even their family members by 18 months of age, it doesn't matter what the parents did, you have to take it seriously. The earlier those changes from the intervention happens, then the children themselves build on those skills. So more and more they reach at higher and higher levels in the trajectory. There are more children out there, as long as they are studying and speaking and getting along, even if they have fairly high number of autistic traits, families just don't count them as issues. So it's a question of what is it that is seen as a problem by the society really.
So nature here we are talking in terms of genetics, and nurture is the social environment or the nutrition or the home environment. Now what we know is there is definitely some underlying factors that predisposes a particular child towards developing autism, and the circumstances ensures it happens. So how do we detect autism? So simple way or simple red flags which any parent can watch out in a child is, number one, by around 9 months of age, if your child is not responding to his or her name, true name or a pet name, then that is a cause for concern. If your child is not able to make a good eye contact by 9 months, if your child is not able to show emotions like smiling or responding to your smile back, then this is a red flag. So it is important to identify and seek appropriate help. But there are some general trends about autism. One is repetitive behavior, for example, switching lights on and off, trying to spin an item, especially addiction to cars or any other toys with wheels. They keep spinning. That is stimulatory. Second one is they don't like loud noises. For example, they react in a very odd way to loud noises like pressure cooker noise or a mixer noise. Children can have various combination of signs and symptoms. So when you notice even one sign, you need to ask your pediatrician.
I welcome the increasing awareness about autism in children, and I particularly enjoy seeing younger children being brought and how well they fare with early intervention. So I think we are really giving them, it's a job of the society to give them that advantage.